if you're using like an implement, like one of those, we'll say kettlebell for a conditioning or cardio workout, how are you determining, I guess it sort of isn't exactly exact sets, but like how are you determining how often you're hitting reps or frequency of the movement? Is it based strictly off heart rate, or is part of it RPE, or do they kind of merge?
They do kind of merge, and I've been using, if I'm getting people to actually monitor their heart rate, a lot of times I'll use the heart rate as the thing that dictates what we're actually trying to get out of the workout, right? So I'll have a circuit of things I want them to get done, but like early on when they first get the heart rate, we're just going to actually explore the things that make it easiest to get their heart rate up, right? For where they already are, like, and I'll know with my clients like what they have in their toolbox, pretty much, right? So a lot of my clients like know how to use a kettlebell at least to do a swing, or like get the bell from ground to shoulder, which I'll call it clean, but it's not like, I don't spend a lot of time teaching it as much as I'll just kind of put the bell in the right position and I'll just be like, all right, just get it to your shoulder, and making sure that it looks safe, not necessarily something that would pass the standards in a strong first certification, but just be like, okay, can you do that? Can you alternate it? Can you get your heart rate, to here? And once it's there, take a break. And then that sort of dictates the rest. It dictates the intensity. And then it also starts to dictate the weight that they're doing, because if you go too light, it takes like a ton of reps to get your heart rate up. And maybe you can't actually even do it unless you go like at a certain speed that you might not be able to go to, right? So you find the easiest way to get the heart rate up, right? So that sometimes is like a moderate bell more than a light bell, because then you don't actually have to do as many reps, and you don't have to go as fast. And if you're older, you might not be fast, right? So like you might not have that ability to actually use speed to get your heart rate up. So it's sort of like dictates like what works best for people, and then they get confident in saying like, oh, I like this movement. Like I'll do this movement more frequently, and then they figure out like other ways, whether it's with body weight or other implements, that they can also get their heart rate up. And then they start to just get a better catalog of ways to do cardio. But then they get, also those movements can easily just be turned into like strength and power by going heavier, doing less reps, not making it about the heart rate, even if I'm having them keep it on. And it's really just dependent on what I think that person should work on, or what they've told me that they want to work on. Most of my clients, though, like have a general kind of idea. They just want more conditioning. So I'll tell you, like the heart rate type of training has been dominating a lot of my sessions. But this is with clients I've been working with for years. So they've also had like several years of actually learning the movement, building up strength, like that they can do heavier bells or heavier weights now. So I think they're just ready for maybe this type of style. And then the clients that have more of like the low impact type of devices, like assault bikes, rowers, treadmills, ellipticals, it again, I just give people the heart rate monitor and say like, okay, just try to get like 30 minutes above 70% target heart rate. And it makes it easier for people to be compliant with that type of work.
Mm-hmm. Yeah. And yeah, I mean, you just touched on it, but I feel like to get to that point where you're hitting or you're doing, playing around with some implements other than those low impact modalities for conditioning, you have to have that level, that base of strength, to be able to, use a weight heavy enough and have it be repeatable enough. Right. In the last few minutes, I know you got to run at 4. Can we talk a little bit about just working on educating your patients or clients without creating like a sense of either having them get like too in their own head or making them fearful of movement, and how you go about doing that?
Sure. I mean, I think
probably should have led with this one.
No, I mean, I think this is actually pretty straightforward. I think where it's don't try to make your sessions focus more on what they can do as opposed to what they can't do. Right. And you'll have to go through your assessment, which everybody expects when they come in to see a PT, that you're going to be assessing, range of motion, or, and a lot of people that I see are like very savvy even to like the FMS and that type of world of like the holistic assessment, right? So people are expecting you to do your assessment, but like when you find something, one, you don't really have to, you don't have to like make a big deal about it. It's just like you're trying to get your low hanging fruits, your chessboard, so to speak. But it doesn't, like, you haven't found anything in the first session. I guarantee it. Like you found some low hanging fruit, but you don't know how things are going to play out until you get people moving and all of that. So there's no reason to make your client apprehensive. Now I pull the skeleton out. I pull like the mobile joints out a lot, just to, when I'm starting to get people doing their initial exercises, to explain like what I actually want them to do. And it's not because they're, I don't try to make it because like they're broken. It's because like I try to make it like most people need this and aren't doing it anyway. So like this is something that, is useful. And the thing I always go back to is like, I'm trying to get you to move from the center out. And you will always be better when you're moving from the center out, no matter what. It's just not an easy thing to do all the time. So this is the exercises we're going to start with, right? And like, regardless of what the injury is, that usually is the goal. I'm trying to get people to move from the center out, which means like I'm focusing on their breathing in some way, and I'm focusing on them starting with like an initial posture with their head, their rib cage, and their pelvis that I'm looking for, and then having them move around that, right? So I'll show them the separation between like the rib cage and the scapula, and like what that looks like anatomically. But I'm not actually trying to put it into any perspective like other people are here and you're here. It's like other people are here too, they just don't have pain. Right? Like, and I think that is helpful. But like I want to get them just moving as much as possible. And then I like often have a conversation like, what are you already doing? What do you feel like you have no problem doing? Do more of that. Or like, let's talk about a program for that. Let's talk about volume of, the things that you're maybe doing too much of. Like, if it's walking, if it's running, if it's things like that. I don't want people to stop if they don't need to stop. Like if it is a volume thing, I'm just going to say like, why don't we just do like this much with these exercises and see how that feels? Because you've already told me that it takes this much to bring your symptoms on. So let's like err on the side of caution and only do this much, do some of these exercises. And then, next week we'll do a little bit more, or we'll start to like mess around with interval training instead of steady state training. Right. Like, so, I think we're wanting to manipulate volume right off the bat, but it's always an assessment to see like, how'd you do with that? Right. So the next time, we either move forward with it or we have to adjust. But just to not make people apprehensive, I just think like, don't try to diagnose them too much. Like if they're looking for something like a why, I'll go into like a biomechanical discussion about, what, I wanted them to be able to do better, usually from that center out model. But I always try to like paint it with, this isn't necessarily why you're having pain, because other people have this and don't have pain. It's just like, this is what I'm backtracking from your pain. And my assumption right now is that this will make you better.
Yeah, that makes sense, and definitely a helpful, straightforward way to put it. I think especially what you said first, like that focusing on what they can do versus what they can't, and that sort of touches on what we've talked before about like how personal trainers seem to do such a good job, because it's just like simplify things to a point where it's like, okay, that hurts, let's stay away from that for the time being and figure out something you can do.
Right. Yeah. And I think we need to be better at that as PTs. We just won't always have the time, but we need to get good at like divvying up the time in a session to go towards what they can do or enhance what they can do, while also working on like what they currently can't do well and what we're trying to get out of them. I have a situation where I work with people longer than most PT clinics will. And so, because it kind of turns into that training element. So yeah, I don't know that like that always fits real well into where you, that quick, you have 4 people at a time. Like, I don't know how that would work, but even just thinking along that line, people will like to exercise when they come to a physical therapy session, even if you're not giving them like one-on-one supervision. So finding different ways to challenge people, in a way that they feel safe, like not actually having you like critique their technique, I think is super important when you're in a busier setting, because you're going to have people do stuff without you watching them. And, like optimizing that time to not just be like exercises that are working on the joint that they're complaining about, but like just building their overall capacity, I think is actually a better way to utilize your exercise card, your flow sheet, than to actually just have them do a bunch of different ways to do like the same muscle or something like that. You know what I mean? Which I know like you see, and I've done it in the past in clinics where I would just be like, okay, someone's got a knee issue. I'm going to give them like 3 exercises for their quad, 3 exercises for their hamstring, like 2 exercises for their glute med, right? And just like, okay, like how many do you need for the same area, right? And and now it's like think along the lines of muscles, but you might think around the lines of like position, do like different positions, but also just give them like a bunch of stuff that's like they know they feel safe with, and that they can leave there feeling like you've gotten them in better overall condition, right? And that's not going to be doing stuff that you have to be cautious with around their injury. It's going to be doing stuff away from their injury that they don't have to be cautious with at all. And from a full system standpoint, you're probably going to get more bang for your buck doing that.
Right. Absolutely. And then they're training more so too. Like you're
exactly.
getting more of a training
effect. Which is why like, I think we have to have that mindset when we're dealing with people, that it's so important to have them to appreciate what they still can do. Right. And, in the training environment, like if you're a PT that's also a trainer and you are seeing people that are your training clients, but then they come in with a pain complaint, which happens, it's going to happen, right? It happens all the time. One of the things I've noticed is just that this is a totally different environment that you would see a person that compared to when they come into the clinic, because they're telling you like the moment or the day of the symptom. So the symptoms are so much more acute. Like, so you have the opportunity for them to be able to stay active around their symptom in a way that you may not have that opportunity when you're seeing someone for the first time in the clinic. And what ends up happening is that person comes in to the clinic and they think, okay, I'm a patient, right? Like I am, here to work on my injury. I'm not just like in a movement practice that happens to have pain that is being worked around. Right. And that's such a big difference, right? So if you can start like any session with saying like, we're going to figure out what you can't do well, and we're going to also figure out what you can do well. And a big portion of our rehab is going to be just enhancing the conditioning of what you can do well, because that'll actually help make it easier for us to work on what you can't do well, right? Like those two can't be separated, or you're going to get just, like you'll get people better, but it'll almost be like on accident. That's what I found. Like when I was in like certain clinical like scenarios where I felt like I was like, people would get better, but it was more on accident, because they already came in with a certain level of conditioning that made it easier for them to get better with the things I was giving them.